I picked this picture deliberately, mainly because one of the issues is that health are essential partners to this, and we've heard that a lot today, that it's not going to work without health. But actually, health is still being put in this pot on its own as a great big blob of a one-type service, and actually it isn't. It's hugely complex, and it's getting more complex by the minute. So, it involves people from different professional backgrounds, in different disciplines, in different organisations, and that's just health alone. And wait until we talk about the commissioning aspects. Right, so we've already heard about the drivers and the evidence, and I would suggest when you're commissioning services that this is probably the only evidence we can use at the moment, because we haven't got any other type of evidence. I'm so pleased that somebody else remembered the messages from research, because I can certainly remember the Blue Book that told us we were not intervening early enough, and we were waiting really for children to be seriously damaged and abused and hurt before we intervened. And really, if you look at the Munro Review, and I've put up the Munro Review there, the same messages are coming out. And they came out with the Laming Review. So it is about earlier intervention to try and stop the abuse from happening. And what we do know from many, many years of evidence, including the Soham murders that have already been mentioned, is that information sharing and the timely information sharing is a factor. In fact, it was the not sharing of the information that are key parts of most of the serious case reviews I look at. I'm actually involved with another serious case review at the moment because we're running the Sky methodology in a couple of boroughs in London, thinking that this is going to bring about lots and lots of different viewpoints about the systems that we use. And I have to tell you that even in the cases that we're reviewing now with the Sky methodology, what is coming out is information sharing and information sitting in places that is not known to other people, which has prevented early intervention for those families. So it is really what was mentioned in the Munro Review is we shouldn't be thinking we'll just do what we did before. We should be thinking about doing the right thing this time. We've got big opportunities in health as we go into the reforms. What I would say, though, at the beginning, and again it's already been mentioned, is that get the right health people to help you implement your MASH systems. And please treat them as equal partners and not as junior members of your MASH project groups, because they are essential to getting this implemented properly. Okay, what are the benefits? We've heard a lot about the benefits, and you're probably up to your ears with the benefits, and you kind of know the benefits. What I would say to the health professionals sitting in the room is this does not threaten existing NHS systems. This is not a takeover to put named and designated professionals out of business. And it is there to help health professionals and to get a much quicker reaction to the children's needs that are coming through the MASH. I do get concerned that some may think that you do not have to refer to your designated and named professionals for that professional advice that we have already established in our systems. That is not the case, and the MASH never intended that to be the case. If a health professional has a query about whether there is a risk to a child or a need to a child that needs to go to a multi-agency risk assessment planning process, then they can, as they always have done, exercise their own professional judgment and use their designated and named professionals for the advice that they would normally have done, and then it goes into the MASH system. That has got to be much better than the last system we had, in that we did all that, sent it into a front office in a social care office. And again, this is something I've seen with the current serious case review I'm working on, and that case sat in an in-tray for 3 months. So I do think the speed of the MASH is something that will really improve our service delivery to children. Okay, so the new NHS, what does it look like? We have now a single operating model in the form of a national commissioning board, which sits up in Leeds. And we have some regional offices of the National Commissioning Board, which sit in various sort of regional localities, a bit like those of the old SHAs, the old Strategic Health Authorities. So it'd be well worth you sort of scanning your own health horizon to see where all these people are. We also have clinical commissioning groups, which are those groups of GPs and clinicians. They're not just GPs, there's nurses on those boards as well, who are commissioning for their local service delivery, apart from health visitors and primary care services, which are still being commissioned nationally. So you can see that there's kind of a local focus, but also a national focus as well to the commissioning of services in your area. So that's quite complicated as it is. So you need to make sure when you're commissioning anything really that all these bits link up, because safeguarding children and adults actually, but children is more defined really because of the legislation, etc., that goes with it, is a responsibility of each of those levels of commissioning, and they need to link up. And the people who are in touch with both those commissioning places are your designated professionals who are still going to be around to support the safeguarding agenda. And I would suggest, if you have not linked with your designated professionals about implementing a MASH in your area, and particularly those in London, you need to do so very quickly indeed, because they are the people that will take this forward for you in the health economy and help you to make sure that the health economy know what a MASH is. My vision is that even the single-handed dentist on the borders of London and Surrey, if he sees a serious mouth injury coming in of a child that he's suspicious about, he will go, right, where's that MASH number? And I don't think we've ever had that kind of system before. Hospital nurses, great. Just some GPs very good at child protection. Community nurses very good. But all these other health providers, not so good. And remember that we're getting a lot more and different health providers out there. I can mention Virgin Healthcare as one, who are beginning to establish their services, all over the place, actually. So we're in a very different place.